that glamorous. So
Okay, and we've got a microphone, haven't we?
we got one right here.
Right.
So you just have to get cozy with me. So this is me taking another 5-minute break from the exhibit area again. But why I'm so excited to be here is because I've just finished telling Vanessa that I've had chemotherapy that just finished 3 months ago. And yeah, thank you. But during that time, Vanessa sent me loaves of her bread regularly, these beautiful ones here, which tell me about how many, like they were something like 39 different grains, right?
It solves the fibre gap problem. You've got 12 grams of fibre in 2 small slices. You've got 30 different ingredients and massive levels of polyphenols, all pre-digested, broken down by the endogenous enzymes, so you get more bioavailability of the polyphenols, feeding your gut, more bioavailability of vitamins, and it's satiating and delicious. So
she's explained exactly what, I could never explain why, but I was basically eating that, and the proof is in the pudding. Usually what happens when you have chemotherapy, it just basically eradicates your microbiome, right?
Yeah.
And in this case, I had a test the week before I started my chemotherapy treatment in November, and then I had a test like a month after, or maybe it was 2 weeks after, and my microbiome.
Provem and the bread, and it's packed and loaded full of antioxidants. What's your thoughts on this and the bread that I teach? Because you're obviously an expert in this area, and people who have cancer are often worried about bread.
Well, thank you for saying that, because we did 2 COVID studies, and the first thing we did in the COVID is improve patients' microbiome. And the nice thing, we saw objective endpoints, but we also, as you said, we saw people day to day were coming back saying they feel better, less bloated, more alert, more motivated to do other things. And the same with cancer. You really need to look after the gut health. Now, there is a bit of a wrongful, I don't know how to say it, but a lot of patients are told not to take fermented foods or things which could potentially increase the risk of septicemia, which is completely wrong. Now, I know your sourdough bread, the bacteria have been sort of killed when it's cooked,
That's
but
correct.
nevertheless it does promote gut health, which is almost the safest way to do it if you think about it. So I would 100%, I always tell my patients to have your bread. Having improved gut health will mean you're less likely to get side effects of chemotherapy, and it's more likely to be effective. And particularly the more modern chemotherapy or anti-cancer agents, such as the immunotherapies, they require your immunity to help fight